I'll share it in a moment. Can you see it?
Yes, thank you.
Yeah.
Let me know when both of you are ready.
Yeah, I'm ready.
I'm ready.
1 second. Okay. Enter the station and do your task.
Hello, is that Sarah White?
Hi, yeah.
Hi, I'm Dr. Mamase. So I understand from my records that you had some issues you wanted to discuss with me about.
Yeah,
Okay.
that's correct.
How can
Yeah.
I help?
Well, doctor, I need help with my eyes. You know, um, I'm really embarrassed by them. They are, yeah, they are very wide apart and they are too large. It's so embarrassing. I can't tell you. Like, my eyelashes, they are ugly, they are misshapen, they are straight. It's just, it's really hard, living with eyes like these.
Right. So thank you for sharing this information with me. It sounds like it's been really distressing for you. You've said your eyes were really apart, your eyelashes are misshapen.
Mhm.
For how long has this been going on?
Oh, it's like most of my life, as far as I remember, I was 13, I think, when I really noticed it for the first time, and I realized it by comparing with my other friends at school, how ugly my eyes are, and since then it's been a pain.
Right. So I noticed some things you've said. You said ugly. So do you think your eyes are ugly?
Yeah,
Right. And you said you were 13 when you first noticed.
yeah.
From my records, I can see you're 27 at the moment. Why have you left? Why have you come now, or what has happened in the interim? Can you tell me more, please?
Oh, so it's a long story, but I'll tell you. I'll summarize it for you. So basically, yeah, I was bullied by people in the school as well. And I have been really trying to, like, I have been trying to, like, get some surgeries done. I have been to a plastic surgeon 3 times,
Right.
to private surgery, but I
Mhm.
can't afford it.
Right.
So, and I won't get it on the NHS. So, I will see how it goes, because if worst comes to worst, I might do it myself, because it's really distressing. But then another thing is, it's affecting me in the meanwhile, like you said, and I try to apply makeup to, like, try to correct them, and I try to wear glasses as much as I can,
Mm,
so that I can hide them, so
right.
there's a lot going on.
Right. I can really tell that there's a lot going on, and thank you for sharing that with me. You did tell me about some risky things that you'd be willing to do, like to try to correct it yourself. Have you made any concrete plans towards this?
Well, not now, but
Okay.
not just now, but I might do it in the future,
Right.
if I don't get help.
Right.
Can you help me, please?
Well, that's what I'm here to do. And you've talked about, being to doctors. Your GP has referred you to me. have you been reassured at all with regards that, things are that, something, your eyes are normal?
Oh well, people sometimes tell me that I kind of they don't see it, the way I see it. So sometimes people tell me, that they are fine, but I mean I can see it in the mirror. I don't see that they are fine. I'm just not happy.
Yeah. So how long do you spend looking in the mirror?
I It can be hours. I just keep looking in the mirror and I keep imagining, like, how, how good I will look if I can get this fixed.
See, I see. And you've talked about putting makeup. And what about other impacts it has had on you? For example, your social life. Do you avoid meeting people?
Oh yeah, yeah. So at my workplace, I have asked for the night shifts, on a long-term basis because I feel like during the night my eyes would not be that noticeable.
Mm,
And and yeah, I can't go out, I can't go to parties or stuff because I just, yeah.
right. And if I asked you on a scale of 1 to 10, how disproportionate do you think your eyes are? One being
Well,
not too bad, 10 being very bad.
I would say 10, doctor.
Right, I see. And has it always been a 10 since you were 13, or has it been getting worse as the years go by?
I think over time I am becoming more and more worried about it
Right,
because I'm noticing it more.
more. And do you think about it all the time, or is it a thought that comes and goes?
No, I think about it all the time. Like this my main problem, it's on my mind all the time.
Yeah. Does it cause you any anxiety?
Yeah, yeah, like I said, I just worry about it so much that I can't
Mm,
even get out of the house, and meet people and
yeah. So you've talked about some coping strategies like makeup and
Mhm.
any other thing like alcohol,
No, no.
drugs?
1 minute.
No, no.
Okay. All right. And has this happened in your family? Anybody with a history of similar thing?
No, I'm the only unfortunate person to have such ugly eyes.
Yeah. Have you been to a psychiatrist before in the past?
No, I haven't been, no. But why would I need to go to a psychiatrist?
I mean, simply because this is the first time I'm meeting. I just wanted to know if you've met any of my colleagues in the past. It's a regular
Okay.
question we ask. And
Yeah,
how
okay.
has it left your mood?
Um, I am unhappy, but that's it.
Would you kill yourself?
No, no, I wouldn't.
Okay. I mean, thank you for speaking to me, Sarah. I think you have something called body dysmorphic disorder.
Mhm.
It's a condition where people feel like one part of their body is really disproportionately or ugly in comparison to the other parts or to other people.
Time
But
up. Okay. So, yeah, let's come to the feedback. You started very well. I'll say you know what to talk, but you were not able to finish your station.
yeah,
Okay. The reason is because there were a few points where I mean, you asked in different questions, but you were actually wanting to elicit the same thing. Okay. Your empathy was appropriate. You were trying to be it looked very like natural. You were, trying to maintain a good rapport, and it did look as if you are trying to communicate very well. But I'll tell you which places you should avoid. Okay. Like you checked the onset very good. Then you said that, okay, I understand that it started, when you were a child, and now you are 27. So what happened? What changed? So what are you actually checking? You're checking progression, aren't you?
yes,
But then there's no question of asking on scale of 10 to 1, where would you rate? How has it progressed? It's you asking the same question. So I say that every time I teach, that whenever you ask one extra question in CASC, you are actually missing out on one important question which you should be asking instead. So every question should be for a purpose. Don't just ask anything. Okay. So if
Yeah.
you ask the onset, plus if the person has said such significant things that, I was bullied, you can't actually miss that. Childhood history is very, very important because that's where it started. So what actually happened at that time? Most of the time you will get a history that during childhood she used to get bullied, but now people are very kind because they have grown up. Then you should also check, okay, when that happened, what was the reaction of your parents? Okay.
Mm.
If friends behaved in a certain way, many times the person will say, oh, they were right, I'm so ugly. Or the boyfriend has broken up because he said that she is very ugly. How have things changed now? Okay. Like how are things at work? What about a social life? So obviously there is avoidance, and she's telling you very clearly that she's not going out. She's going to work at night. She's wearing glasses. She's trying to use makeup. So lots of things are there. You check the compulsive behavior. But be careful, like the bullied thing, I would rather question that later. That I'm sorry that, or thank you for sharing your, or being so honest about your experiences in the past. I'm sorry that, you shared that you were bullied when you were a child. Is it okay to share that a bit more, maybe? Or are you comfortable to share that? Okay. And then get a bit of a history. How was your childhood otherwise? Okay. And okay, so she said that I would like to correct it myself. So if you are asking what plans, and she said, "Oh, really? I don't know." Okay, so maybe there's a bit of more like that you should be asking that what sort of plans are you thinking? Like, is she planning to buy some instruments? How is she going to do that? Okay, she
Yeah.
already told you about the professional she has visited before. Does she have any social support now? Okay. Then past history, good, you checked. Yeah, there should be the childhood. The impact on the mood, yeah, that's fine. But when you are checking, like, the impact on work, impact on her, self-esteem, it's good to check impact on her personal life. Has it impacted her personal life in any way? Okay. Impact on her mood. Always don't rule out depression. Many times people have a low self esteem, low body image because of also comorbid depression. So, no history station should be without differential diagnosis. Okay, so, do you have enough energy to go through the day? Just ask a few questions. Are you eating well? Are you sleeping well? Okay, and yeah, other thing about conviction. Okay, now you asked one question that has anyone told you that your eyes are normal? Try to avoid these terms, normal, abnormal. Okay, try to avoid them because most of the times the actors in BDD are not very cooperative. They really shout, and the first question they ask is, when you say that you are a psychiatrist, first question they'll say, "Why the hell am I seeing you?" So they are already very off from the beginning. Try to avoid these terms like normal, abnormal. Okay. So say something else like, okay, do you think, you could be wrong in any way?
Uh-huh.
Yeah. Is there any way you could be wrong? Okay. What have others said? Have you discussed this with anyone else? What are their views? So go ask the same question, avoiding terms like normal and abnormal. Okay.
Yeah.
Coping, you checked. Uh, yeah. So mainly avoid repetition. Family history, when you are asking, does anyone have a family history of similar thing? Okay. Rather say anyone has got any, in your family, anyone has got any mental health issues. Okay. It may not be BDD, it could be something else. It could be eating disorder.
Yeah.
So when you give an open question, they're more likely to answer. Okay. When you want to check the conviction, always check, has she shared it with others? Do others feel the same? Has anyone else commented on how she feels? These are more questions which can take you, and I mean, it's in a way, are you asking the same question, but just in a more gentle manner. Yeah.
Yeah.
So just keep these in mind. Like I think in my previous station also, I mean previous thing which we had last Sunday, also I said that when you have a history station, you should be actually checking all domains. We should not, you should be including the differential diagnosis, the risk, past history. Try to, cover it as much, no matter what the history station is, but you should be covering all domains. Okay.
Yeah.
Okay. Any questions?
I know. Thank you.
Okay. Should we move to the next station?